Ah, that back pain. We've all probably had it at one time or another. It's one of the most common medical complaints we hear from our viewers. So I turned to chiropractor Dr. Peter Osborne with Town Center Wellness to find out about a way to ease that pain. Our viewer Brad is really concerned about low back pain that he's had forever, and he keeps reading about spinal decompression, but he's wondering a couple of things. Is it safe and is it doable? Is it going to really help him in his pain?
Well, spinal decompression is a very effective therapy for people with degenerative disc disease in their necks or backs. So to answer Brad's question, yeah, absolutely. I think it would be certainly something worth looking into if he could follow up with a doctor who has a spinal decompression table and maybe have a consultation done to see whether or not the therapy or the treatment would be beneficial for him.
Walk us through the steps. What happens when you get on that table?
So basically what happens is you're strapped into a couple of belts. These belts are just stabilizers. The table pulls, basically it pulls based on an angle. So if you have a degenerative disc or a herniated disc at a certain level, we can actually accommodate the table to target that particular area where you have your degenerative disc. Once you lay down, you lay down on the table. We have you in certain harnesses and you wear headphones, listen to some music, and just kind of take a nap and relax. The table itself does the rest.
How long does it take to see results?
About 20 minutes.
And then how many sessions do you have to do?
Yeah, so 20 minutes is a session. Right. How long does it take to see results? Usually 5 to 10 treatments. We're really starting to see the impact of those treatments starting to affect pain levels or radicular levels, but it takes it's a minimum of 20 sessions to really be effective for the therapy to work.
Once you finish those 20 sessions, are you going to see results forever?
Well, there's no such thing in forever. Yes, you could. You could if you took care of yourself, if you ate properly, if you had the right nutrition, if you exercised appropriately. But if your disc was caused because your lifestyle is too sedentary, in other words, if your degenerative disc is there because you don't exercise enough and you sit down at a desk for 12 hours a day, is there a likelihood that that disc problem is going to come back? Yes. You have to also take and make modifications to your lifestyle. You have to adjust the things that got you to that herniated disc in the first place. Otherwise, there's always a likelihood that it's going to come back.
Is this type of treatment covered under insurance?
No. Spinal decompression is not one of those, as of to date, that's covered by insurance. It is recognized by the FDA. It's just a matter of time, probably.
And about how much does it cost?
Each session is going to run about $180 a session, so a total session of 20 would run around $3,500.
But then you wouldn't have to undergo surgery if you did that and were relieved of your pain, so that might be a positive even though it's expensive.
Well, it's a lot less expensive than surgery. Your average surgery is going to run a minimum of $20,000, so there's a big difference.
All right, thanks, Dr. Osborne.
You're welcome.
If you have a question to ask the doctor, you can contact me through Twitter or Facebook. Just hit like on my Facebook fan page under Melissa Wilson, Fox 26. I'll get out there and get all that information for you so you don't have to do it.
Seems like it would make you taller, too.
Doesn't it, though?
Out your
yeah,
spine,
at least make you stand a little straighter, I guess.
Very good. Interesting information, because my back hurts a lot, too.